There are a number of patients that come to our office primarily because of wasting and dissension of the midface fat. Although we have their expertise to provide them a like replacement with their own fat, with their own platelets, we also have other ways to complement that fullness without using the patient's own materials. One of them, of course, is Voluma, and Voluma is a hyaluronic acid volumizer that can be used in the most appropriate way to fill in the midface without surgery. But frequently we have to combine this with devices that will tighten the skin, and yet we have fillers or volumizers to fill. This frequently will satisfy the patients with the very early findings. Fat replacement has been an area of my research clinically. Over the past 8 years, we have been involved in perfecting and understanding the reduction of fat in the midface. This will happen with everyone. In the anterior midface, which is the part just underneath the eyelid and just adjacent to the nose, is a large fat pad called the malar fat pad, the cheek fat pad. The cheek fat pad really consists of at least 6 separate compartments. Each of the compartments may undergo their own timing for reduction of fat and wasting, and their own timing for sagging. If it were to be a surgical procedure, we would of course elevate that fat pad at the time of a facelift procedure, and at that particular time also replace that fat with the platelets. But there are patients that do not require that. They just may have the early beginnings of skin laxity and the early beginnings of irregularities because of fat reduction to the midface. In these particular patients, we can isolate that. We can provide them with their own fat injections. We can also go to a substance filler or volumizer called Voluma. And each of these particular types of volumizers can satisfy the filling of the anterior midface without significant downtime. We can also combine these areas with devices that will tighten the skin and the muscle, so in effect simulate a facelift procedure but is in no way equal to a surgical procedure.